Hi, Sophia.
Hi.
Oh my gosh, thank you so much for joining me today. I know you are a busy professional lady who's probably going to be getting ready to go to work soon. But listen, I am so happy that I have a chance to talk to you today. You are one of our legacy patients at MSI Integrative Healthcare. You've been a patient for over 10 years now. Can you believe that?
That's crazy.
That is wild. And so I just have a few questions for you.
Yep.
This is not scripted. We didn't prep behind the scenes. It's really, I just wanted a chance to talk to you as one of our legacy patients. And so if you could think all the way back to 2016, how did you find MSI?
My mom was a patient. I don't know how she found you guys, but my mom was a patient, and scoliosis runs in my family, and I was having a lot of neck and shoulder pains. So she was like, "All right, time to go."
So mom trusted you, her baby, right now grown woman, with us, and you've
Yeah.
been with us ever since. And so, why have you stuck with MSI for over 10 years?
Pain relief. That's the biggest thing is pain relief, pain management as well. Um, I've really noticed a difference when I'm consistent versus not. When I have flare-ups or something going on and they say, "Okay, we're gonna come, once a month for or a couple times a month for a couple months and then kind of wean you back down again." So it's kind of just like dependent on what my body needs, and it's really nice.
So you've gotten results at MSI, and you notice that the care plan that you have and the recommendations from your doctors
Yeah.
actually get results. And so, how important has your health care been to you? Like, I guess the specific question is tell us how important your care has been to you as you've grown into a woman, as you enter the workforce. Tell us more about that.
Super important. If you don't take care of your body when you're young, you're going to be messed up when you're older. And I see it every day at work. Um, some of it you can control and some of it you can't. So anything that I can control, I'm trying to, keep in check so that I'm not miserable as I get older. But it just really helps with everyday life. I mean, you can't be in pain all the time and function at your best self.
You sure can. That's the truth. And it seems like such a simple thing, but a
Yeah.
lot of times we miss the mark because when we're young, our bodies can a lot of times heal quicker, bounce back, but it's
Hmm.
only a matter of time before those things catch up with you. And so you started with chiropractic and physical therapy, physical medicine overall as a young person.
Hmm.
And now you're taking some of those key health habits to you in your adulthood. And so share with whoever is going to hear this, who knows, but share a little bit about the extent of your care. What types of care? Because MSI is an integrated health company. We actually look at the whole body. And so our physical medicine is integrated with um, chiropractic, physical therapy, some advanced technologies like decompression and shockwave, and then obviously our neuropathy reversal and cell therapy, aka stem cell program. So just tell us a little bit about what you've invested in, what's worked for you at MSI.
So I started off, gosh, like 10 years ago, doing adjustments, STEM, and physical therapy. I think it was like 3 times a week to really help correct everything that we could, like scoliosis wise. I've been in and out of maintenance plans where I just come for STEM and heat or ice and adjustments. But within the last couple years, I've tried the cold laser therapy. I get
Mhm.
these weird knots in my chest that are just so hard to get rid of. Cold laser therapy was amazing for that. I come usually once a month for my adjustment and like heat and stem, but recently I just started trying the shockwave and I've noticed a really big difference in my shoulders. I'm always stiff up there, and it's like no matter what kind of stretching, workouts, whatever I do, it's always just tight here. Um, so I've been noticing a difference with that.
So you start off with cold laser. Cold laser is an amazing non-invasive therapy,
Mhm.
clinically proven for non-invasive pain relief for the muscles. Accelerates the healing process up to 4 times faster. ShockWave is probably our most advanced technology at MSI next to stem cell therapy,
It's
right?
intense.
So it's intense, but it works.
It does.
Tell me, you mentioned your job a couple times. What do you
Mhm.
do for work?
I'm a nurse. I'm an
So,
ER nurse.
so you're a nurse, you're on the front line, you're literally helping people get better. And so you, Sophia, need to be feeling your best in order for you to be with someone else helping guide them for their care. And
Yeah.
so you notice these knots in your upper back, your shoulders, your neck, and all of that. And Shockwave has helped you. What were you like before, and what do you notice after your Shockwave therapy?
I'm usually pretty stiff. Like when I wake up in the morning, my shoulders kind of live here.
Mm,
So it's just been a little bit easier to kind of get them out of that. Usually in the morning and at night, especially like in the morning after a shift, my shoulders are really just like stuck here. And I'm not having as much of that stiffness. I don't feel as locked in here, which also
mhm.
helps open up my chest. Cause like I said earlier, like I get these weird knots on my sternum. So when I can bring my shoulders back and open up here, it makes it a lot easier to just not be a hunchback.
Yeah, less pain, less stiffness, less
Yeah.
discomfort, better range of motion, better
Oh yeah, that's a
ability
big
to
thing.
function. Oh
Yeah.
my gosh, and sleep and get up and start your day. And so those are really important functional pieces for any person out there that wants a better quality of life.
Yeah.
So that is incredible. So kudos to you for branching out and doing something different so that you can get a better result. Um, my last question is, what would you share to the audience out there if they're looking for an integrated health practice that will listen to them and help guide them on their health journey? What's your advice for them?
Do it. No, but seriously, do it. There's nothing wrong with coming in and seeing what they have to say. I think a lot of people are skeptical of chiropractic care, which is totally fair. You know, it might not be for everybody, but I think they just think you go in, they crack your back, and then you leave. But it's a lot deeper than that. And it's not just, oh, I'm having back pain. It's, oh, this is wrong structurally. How do we work on that to prevent pain in the future?
Absolutely. Thank you so much,
Yeah,
Sophia.
of
You're
course.
amazing. I hope you
You're
have a
welcome.
great day.
Me
And
too.
listen, you know we've got your back. No pun intended. No
Literally.
pun intended. I did not mean it like that. But listen, have a wonderful day and we'll see you soon.
Thank you. Have a great day.
You too.
Bye.
Bye.